Dutasteride or finasteride, whichever is suitable for hair loss. Does dutasteride or finasteride have side effects? What is the mechanism of action of dutasteride and finasteride? What is the side effects of finasteride and dutasteride? And does dutasteride grow hair back? Does it help in hair loss? Is dutasteride or finasteride a testosterone blocker? These are the topics that we need to speak about, and we will speak about these issues today in this video. In this video of today, we will speak about the DHT blockers, that is dutasteride and finasteride. Speaking about the mechanism of action of finasteride and dutasteride. First of all, we should know that finasteride and dutasteride both are DHT blockers, specifically made for a different purpose, but they have secondary action of DHT blocking in the body. Now, speaking about the mechanism of action. Speaking about finasteride first, being an older drug, it is a non-selective inhibitor of 5-alpha reductase inhibitor. In short, this prevents the conversion of testosterone to DHT. It does not block the testosterone. Now, when we speak about dutasteride, it is a very selective blocker for 5-alpha reductase inhibitor. Because of this issue, we see much side effects in finasteride as compared to dutasteride. Dutasteride, being a newer drug, it is a selective blocker. Being selective in nature gives it a high amount of potency compared to finasteride. So if we compare finasteride and dutasteride side by side, finasteride gives us a result of 70% of DHT blockage within the body on using it on a regular basis, whereas dutasteride gives you up to 90% of DHT blocking within the body on regular usage. This was the mechanism of action of both these products, and first of all, we should know that finasteride and dutasteride were both prescribed for BPH, and it has a secondary action of androgenetic alopecia. It helps in the hair loss, hair regrowth, and this is done by only blocking the DHT within the body, that is conversion of testosterone to DHT, dihydrotestosterone. This was the mechanism of action. Now coming to the clinical trials. There was a clinical trial done regarding finasteride and dutasteride among 917 people, and this clinical trial was done for at least 29 weeks. The results of this were very astonishing. Finasteride gives us about 70% of DHT blockage within the body, and dutasteride gives up to 90% of efficacy of DHT blockage within the body. Compared with placebo didn't give us that much results. Hence, dutasteride is more greater and more potent in action compared to finasteride. Clinical trials also proved that placebo effect is very high among both these medications. That is, if the patient is knowing about the side effects and is taking the medications, it causes a placebo effect even if you give him placebo. In this case, we have observed that placebo effect is pronounced in usage in finasteride and dutasteride. That is, when a person thinks about the side effects and he is taking the medications, he is well aware of the side effects and he is taking the medications, those issues, they turn into reality and they turn into side effects. This is known as placebo effects, even without giving finasteride or dutasteride. This was the clinical trials that we spoke about and the studies that had been done in dutasteride and finasteride. Now, there are vast amount of studies and clinical trials along with the results in finasteride. Because it is an older compound, it is an older drug, and compared to dutasteride being a newer drug, newer compound, there are less amount of studies and clinical trials to prove its efficacy. Hence, finasteride is US FDA approved and dutasteride is not. Does hair regrow with the help of DHT blockers? Does hair fall reduce with the use of DHT blockers? Speak about this issue. DHT blocker in general, they help the hair follicle in getting less damaged by the DHT. DHT is converted in the body. It is made within the body from testosterone. When DHT is produced in the body, your body will automatically convert the testosterone into DHT, and this impacts the hair growth. Hair follicles get impacted by DHT, which causes hair loss, thinning of the hair, and miniaturization of the hair follicles. When we think of hair loss in an individual, that is a male individual, the first thing that comes to mind is DHT is one of the main reasons for hair loss. There are secondary other reasons also, like nutritional deficiency, inadequate sleep, then lack of personal life. That is, the personal life is not so good. They are very obese. They are not so well versed with their cardiac activity, less of physical exercises. All these things also play a vital role in hair loss. But this is not the topic to be talking about. It is only about DHT today that we are speaking about. Dutasteride and finasteride, they are used for BPH also, that is benign prostatic hyperplasia, and due to their secondary action on DHT reduction in the body, it is also used in hair loss widely among the world. So if you go to see, a patient suffering from BPH is also given the same medication, and the patient suffering from androgenetic alopecia is also given the same medicines. Now, when an individual is taking 1 mg of finasteride and he is taking it on a regular basis, compared to dutasteride, the half-life of dutasteride is longer compared to finasteride. Hence, the dosage needs to be reduced. 1 mg finasteride taken on a daily basis give up to 70% of reduction of DHT within the body. And on comparing it with dutasteride, 90% of DHT reduction in the body on taking it on a regular basis. But the dosage of finasteride needs to be very frequent because of its half-life as compared to dutasteride. Hence, an individual taking DHT blocker in general, it helps in the hair follicles that have been miniaturized due to DHT action on the hair follicles. They all start regrowing their hair, the hair becomes thickening, the hair starts becoming thick, it starts to regrow, the miniature hairs which were not growing before also start to grow. So this is the effect of dutasteride and finasteride. Speaking about the side effects that come to mind and are very common in the general population on the use of dutasteride and finasteride is decreased libido, decreased urgency of sexual urge. The other effects such as allergic reaction to any medication come as in case of dutasteride or finasteride. If the person is allergic to it, not responding well, he needs to stop the medication. These three side effects are very common, and the fourth one being placebo effect. The placebo effect is very common in every individual who knows about these side effects and are taking these medications. When they think about these side effects, they automatically get those side effects without the medicine causing these issues. Now, these side effects that I have mentioned is very rare in our general population, and if any individual faces such side effects, he should consult his physician who has prescribed them. So on stopping the medication, it is not a permanent side effect. It is a very temporary side effect, and it is very reversible. One should not get scared upon facing such issues or side effects on using this medication, but he should consult his physician, the doctor that has prescribed him the medication, to know any alternative techniques or to cause the reduction in the side effects. They will help them. Now, when we speak about hair regrowth, the hair regrowth occurs once the patient has been started on any medication. Take DHT blocker, that is finasteride and dutasteride. For this example, a patient is started on this medication. It takes about 3 to 6 months for the effects to be visible, very pronounced, sometime within 2 months, sometime within 3 months. Now these effects, they start to show on an individual after 3 months. Now the dosage and the course of the medicine is all dependent on the doctor and the patient's ability to respond to the medication that has been given to him. Every individual's body is very different from each other. Every patient responds very differently from the medication being provided. The doctor will in general give you a particular customized regime of medication intake. Upon that, the doctor will assess you and know the amount of medication that needs to be given to the patient. The dosage can be reduced. It can be in a mixed combination of finasteride or dutasteride. It can be on a daily basis. It can be on an alternate basis. This is all dependent upon the doctor, and he will advise the patient to undergo these changes with the medication dosage and regime. So when are the results visible? As I've spoken, that it takes around 3 to 6 months and even up to 1 year for the results to be visible once the patient is on these medications. Now, when the patient initiates this medication, it may initially cause increase in hair loss, but over a period of time, that hair loss subsides as the medication becomes very stabilized. The level of medication in the body stabilizes. Once that happens, the hair loss also stabilizes, and from there on the patient starts seeing positive results of hair growth, hair fall, hair thinning. All these issues have been reversed. Now at New Roots hair transplant clinic, all the doctors give patients different advices. They have a customized routine. Every individual gets a customized dosage and regime pattern of these medications being provided. So it is not the same for every patient. Sometimes a patient may need to take the medication for 3 months, 6 months. It can even go till 1 year and beyond that. To see positive effects, the patient is in direct contact with the doctor. The doctor will advise the patient according to his efficacy and how his body is responding to the medication. So we can reduce the dosage by, instead of taking it daily, we can reduce the dosage to alternate days, maybe even twice a week. And it can be depending upon the person's body, that his body is responding to the medication and releasing that much amount of testosterone, and the DHT within the body is reduced. It is not zero at any point. We do not want to make DHT at 0% at any point. We need to keep the levels of DHT very reduced to prevent hair loss and thinning of the hair. Now we over here assess the patients depending upon the type of baldness, the type of hair loss, the pattern of hair loss, the cause of hair loss, and the main issue of hair loss. Whatever be the reasons among these, we need to assess the patients. And at this clinic of New Roots Hair Transplant Clinic, all the patients are assessed accordingly, and they are given a certain regime of dosage and pattern of medication intake, ranging from 2 months to 3 months, even 6 months to 1 year and beyond. This all depends upon individual's body. Every individual is not the same, so it differs from individual to individual. Once the patient consults the doctor will take a look at his condition, and depending upon his condition will prescribe a proper and a really good regime of dosage of medications, and he will also advise the patients of how long to take these medications and till how long they should expect their results to be intact, and how long they can expect their results to be visible. So that's it for today with this video. Thank you for watching everyone. Bye bye.